Measurement-based care is a collaborative clinical practice that can be integrated into any mental health treatment over time. And we use, at least the way we define it, patient-reported outcome measures or PROMs to track progress over time, to increase engagement, and to collaboratively discuss goals and changes to the treatment plan. And we really, really emphasize transparency, collaboration, and using PROMs to pause and take stock of how treatment is going, which allows both clinicians and clients to get on the same page and to strengthen alliance. So very, very quickly, collect, share, act. You collect measures, share measures back and have discussions about them, and then you do something with the measure. And we're going to undoubtedly talk a little bit more about that, but there's lots of information if all that is new to you to catch you up. And just overall, you'll hear us talking about the evidence for measurement-based care. And there is really strong research in psychotherapy in particular that measurement-based care improves outcomes and what I think is really cool, decreases dropouts from care.